In 2018, more AOA members than ever before stepped forward for patients and for the profession. From doctors to students to para-optometric staff, nobody sat on the sidelines when it came to the biggest issues facing optometry. AOA members don't take issues sitting down, especially when the public safety is at stake. I've seen this firsthand as AOA president. In 2018, we continued to crack down on illegal contact lens sales, and we stepped up our fight against the Federal Trade Commission's short-sighted proposed contact lens rule changes. In March, more than 60 AOA member doctors and future doctors of optometry made sure their message was heard during an FTC forum on contact lenses. These volunteers called for a long-term, patient-focused solution that targets illegal sales instead of unneeded paperwork. Their voices were loud and clear, since they represent more than 45 million contact lens patients nationwide. We didn't stop there. We followed up with a formal comment letter to the FTC. Then, almost 500 more doctors and students showed up for AOA on Capitol Hill for in-person advocacy, including meetings with White House staff. The Healthcare Alliance for Patient Safety pushed the issue further. Led by Chair Deanna Alexander, this collaboration among leadership partners AOA, Johnson & Johnson Vision, and VSP, and associate partners CooperVision and Sightbox helped ensure a seat at the table for the FTC's contact lens workshop. Our persistent message about illegal sales is getting attention also. One case in 2018 led to $140,000 in civil penalties for 36 Texas retailers. The dedication of doctors of optometry goes beyond contact lenses. In 2018, we pushed back against dangerous diabetes legislation that would take optometry out of the decision-making loop. When we look back at 2018, it's clear. When AOA members step up, our profession moves forward. Our patient safety and eye health messages have more reach than ever before. As AOA President-elect Barbara Horn notes, the AOA's media advocacy machine is putting optometry's priority messages front and center with the media and, most importantly, patients. From the national Think About Your Eyes campaign to daily media reach, the AOA drove more than 3,000 media segments in 2018. The public saw us as they started their days with CBS This Morning. They read about comprehensive eye care in USA Today, Politico, and through other popular outlets like BuzzFeed. And we had a real fighter in our corner. Undefeated world champion boxer and TV personality Laila Ali added her voice to the Think About Your Eyes, School's Out campaign. Ali's post packed a punch because it was personal. She talked about childhood vision problems, her own and those of her daughter. Ali's message reached nearly 800,000 people. Those numbers are building on historic success for Think About Your Eyes. These numbers back up our message. Optometry is critical for meeting the nation's health needs. AOA helps doctors not only meet their patients' needs, but also satisfy their Medicare quality requirements at the same time. How? With AOA More, optometry's clinical registry. Dr. Zachary McCarty, chair of AOA's Quality Improvement and Registry Committee, says AOA More doesn't just improve Medicare reimbursement. It helps optometry tell its own narrative about its role within public health. Data is a big part of that narrative. In 2018, AOA More included data from 1.2 million patients and 2,150 providers nationwide. The registry allows us to identify the top diagnoses and the top prescribed medications among other care trends. With HIPAA protections in place, it lets doctors of optometry compare patient cases and see how peers are performing on quality metrics. And it's helped protect more than $721,000 in reimbursement. This is all just the tip of the iceberg. As more doctors of optometry join the registry, more will optimize their patient care and maximize their reimbursement. Diving into the world of big data is just one step into the future of optometry. In 2018, we made massive strides in research. The 2018 AOA Optometric Research Summit convened the AOA, the Department of Veterans Affairs, the Department of Defense, the Association of Schools and Colleges of Optometry, and others for a long-range strategy session. The AOA Council on Research connected them with officials from key federal agencies such as the National Institutes for Health, National Eye Institute, and the CDC in an open dialogue about the future of clinical research in eye care. As Council on Research Chair Heather Anderson says, the summit was about breaking down barriers and creating partnerships, all to advance patient care. AOA is advancing the skills of doctors of optometry also. For the first time ever, attendees at Optometry's Meeting 2018 participated in education courses on advanced and surgical procedures. We're taking on new efforts to expand scope of practice in states across the country. New courses such as these ensure that when scope expands, our members have the skills to practice to their fullest abilities. I've seen it firsthand, and 2018 just reinforced it. When doctors of optometry have the choice between sitting on the sidelines or stepping forward, they step forward.